So hello and welcome to our webinar, The Pelvis and the Pelvic Floor. This is part 3 of the Pelvic Pain Virtual Management Programme webinar series. My name is Sophie and I'm the Volunteer Coordinator for Endometriosis UK. We're really pleased to be joined today by our guest speakers, Rebecca and Emily, who will be introducing themselves in just a moment. Before I hand over, I would like to remind viewers that this webinar will have a Q&A section at the end, where both Rebecca and Emily will be answering live and pre-submitted questions. If you do have any personalised medical questions, please reach out to your healthcare providers. And without further ado, I will pass on to our two speakers tonight.
Hi everybody, welcome along. It's great to see so many of you here this evening. So I'm Rebecca, I'm a pelvic health physiotherapist and the joint team lead at North Bristol NHS Trust.
And I'm Emily Jones, also a pelvic health physio and joint team lead here at North Bristol NHS Trust. So the advice we're covering today does not replace any advice you've otherwise received based on your individual circumstance from your healthcare team. And as usual, any concerns that you might have individually should be raised with your individual GP, gynae team or physiotherapist. In this webinar, we're going to be focusing on practical advice, which will give you some simple tips to try incorporating yourselves. Previous webinars from Endometriosis UK have covered what to expect when seeing a pelvic health physio in lots of detail. And there's also a detailed webinar on bladder problems that you might want to view. Our webinar today is part of a series of 5 delivered by various members of the team here at North Bristol NHS Trust, and we'd really recommend that you dip into all of them as and when you can. And the idea is that together they provide a whole package of information and advice to help support you in managing your endometriosis symptoms. And certainly the previous presentation on pain and flare-ups is important in providing a foundation of knowledge to support the advice in this webinar and future ones in the series.
Okay, so pelvic health physio can be helpful for a number of symptoms associated with endometriosis, and in the webinar this evening we're going to be focusing on how physio can contribute to the management of pelvic pain, tips for healthy bladder function, tips for healthy bowel function, the pelvis and the pelvic floor, and reframing movement and exercise. Sexual function is another big topic and it's going to be covered in its own webinar later on in the series, so do look out for that one. Essentially, our aim this evening is to provide education to help improve your understanding and to hopefully equip you with some practical tips to work on improving function, be that of your general activity, your bladder or your bowel, and to improve the management of pain. We're being ambitious with what we're covering. We've got lots to share. So it's a bit of a whistle-stop tour. Bear with us and make sure to come back to bits in your own time and things as well. So just a few recaps to get us started about endometriosis and persistent pelvic pain. In webinar 2 in our series, the idea was introduced about the nervous system becoming more sensitive in the context of persistent pain, meaning that it fires off really readily and it gets really good at reducing and turning up the pain. Remember as well that pain doesn't always link directly to the amount of damage in the tissues. We know with endometriosis associated pain that the severity of the pain doesn't always exactly match the severity of the disease. So there's more going on and the nervous system can be playing a key role here. Also a reminder that there are many other things that can impact pain, so stress, poor sleep, past experiences and many other things. And a final reminder that none of this means your pain isn't real. It absolutely is. What it does mean is that in order to improve things, it might be that you need to look at a range of measures that address the variety of factors influencing your pain. So alongside sort of possible surgical management, medicines and hormone management, it's also about exploring techniques that can influence the nervous system. What's important is it is possible for pain to change, and we appreciate that that might be slow and it does take some hard work. So the role of physio with pelvic pain and endometriosis is outlined really well in this infographic, and today we're going to be focusing on a few of the areas marked there. But I want to also remind us about how important it is to take a holistic approach. So again, touching back to those other webinars and future webinars so that you do get that information on sleep, on relaxation, nutrition, how to manage activity and flare-ups and things as well. Various physiotherapy techniques help to form part of this bigger toolbox to help manage endometriosis symptoms. And it's really about being able to make a combination of smaller changes for having good effect. We know that physiotherapy is best when we take what we call a multimodal approach. So what we mean by that is that using a variety of different techniques and tools. And when we consider physical factors as well as psychological and social ones too. Physio is most effective when combined with a pain management approach. And that's where we're talking about sort of education around pain, as well as setting goals, and perhaps might include some input from pain management specialists as well. So the tips we're going to go through in the sections coming up related to your bladder, to your bowels and your pelvic floor and exercise all kind of feed into pain management as well. Very briefly, I think it's useful to see that endometriosis often coexists with other pelvic pain conditions. So you can see kind of IBS, bladder pain, vulvodynia and others. And in addition, there's an added burden of symptoms when pelvic pain overlaps with other global conditions like fibromyalgia, for example. So this is referred to as chronic overlapping pain conditions. And we understand how trying to manage multiple conditions can feel really overwhelming. The good news, or the point we want to make really, is that a lot of the info we're covering tonight and in the rest of the series will relate to other pelvic pain conditions as well. So do bear that in mind.
Okay, so let's get going on bladder and bowels. So we know that bladder and bowel symptoms are common with endometriosis, and in clinic we often support women with a variety of bladder and or bowel symptoms. For example, that might include urinary frequency, pain on passing urine, constipation, painful bowel opening, amongst many others. The stats indicate that up to 90% of women with endometriosis report some gut symptoms, and around half of women with endometriosis report bladder symptoms, and that's compared to the statistic of a third of women without endo. Bladder or bowel symptoms may be related to endometriosis lesions, but we know this isn't always the case, and there's often many factors that are contributing to these symptoms, such as changes to the nerves or the nervous system sensitivity within the pelvis, inflammation, certain medications, previous gynecology or endosurgery can also be a factor, and pelvic floor muscle dysfunction can also contribute to these symptoms. Symptoms may be cyclical, related to hormones and cycles, and we know this is quite common. In the luteal phase, which is just before a period, we know progesterone levels rise after ovulation. High progesterone can slow gut motility, leading to more constipated poo or bloating. And in the menstrual phase, during the period, progesterone levels drop and levels of prostaglandins rise. And this helps the uterus to contract, shed its lining, but it can also cause the smooth muscle of the bowel to contract, leading to more frequent or looser poo, and can cause irritation of the bladder or changes in the bladder sensitivity. And for some, symptoms are more consistent throughout their cycle. There may also be pain related to bladder and bowel function, which this can be really challenging, as we know these are necessary daily bodily functions, and pain may impact how the pelvic floor muscles are functioning. And as Becca outlined, there may also be coexisting or underlying conditions like IBS or bladder pain syndrome. So we'll start with bowels. So when it comes to bowel, what's normal? Normal frequency is defined as anywhere from 3 times per week to 3 times per day. And so it can depend on what's usual for you. And the ideal poo consistency should be a formed but soft sausage-shaped poo. So how do we poo? When the poo enters into our rectum, which is like the holding chamber for our poo, the stretch receptors in the rectal walls are activated. And nerve endings send signals to the brain, creating an urge to poo, and we might become aware that we need to go. These nerves also trigger a relaxation in the anal sphincter, and our sphincters are rings of muscle around the anal canal and form part of our pelvic floor. The internal sphincter relaxing allows the poo to move into the upper part of the anal canal to sample what's there. Our bodies are really clever, and so these nerve endings can distinguish between gas or poo. And if it's gas, we may choose to voluntarily let the external sphincter relax, allowing gas to pass. Or if it's a poo, or if we're not in a convenient place to go, the external sphincter can contract to help hold it in. If we're on the toilet and we are wanting to pass the poo, the sphincters relax together with a small rise in tummy pressure, and the pelvic floor muscles must also relax and lengthen to allow the poo to pass through the anal canal and out of the body. Good functioning pelvic floor is important for bowel function, and we need strength and endurance in order to hold on to poo or gas, but also the muscles must relax and be able to let go to open our bowels. When things go wrong, we may experience symptoms such as problems having a poo, difficulty going or not emptying properly, or it might be problems holding on, or sometimes it's both. If you notice any of the following symptoms, these do need to get checked out, and you should always speak to, excuse me, you should always speak to your doctor or one of your healthcare team. So this includes any changes in bowel habit from your normal. If you notice any blood in your poo or blood from your bottom, tummy pain or bloating that persists and is different from your usual symptoms, increased unexplained fatigue or tiredness, unexplained weight loss, or new pain on opening your bowels, or if you have bothersome symptoms relating to bowel function that aren't responding to simple self-help advice, then you should also seek help. Next slide, please. The following tips are important to all of us, especially if there is difficulty going, but also if you struggle to hold on. And these tips can help form the basis of a good bowel function. Stool or poo consistency can be influenced by what we eat and drink. We know if we're dehydrated, this can cause firmer or harder poos. Aiming to drink around 1.5 to 2 litres a day is important for bowel health. Fibre is also important and can influence bowel function. Fibre in our diet helps to bulk our poo, which can help it to move through the digestive tracts, and also helps to form and soften the poo. The guidance for fibre intake in the UK is about 30 grams daily for the average adult. So altering your fibre intake can help to improve your poo consistency. I'd encourage you to refer back to the webinar on nutrition for some further advice and ideas about diet. Part of a good functioning bowel is routine and predictable bowel habits. And we can help support good bowel routine by tuning in to when we get the urge to go and trying not to ignore the urge for long periods of time, as this can lead to a firmer poo consistency, and over time it can actually reduce the sensitivity in the rectum. Eating a meal can help stimulate the bowel, so ensuring you have a good breakfast plus a hot drink in the morning can help get the bowel active first thing. And generally our bowels are active after 20-30 minutes after eating, so we can pay a little bit more attention to any signals that we might get of needing to go around this time. Exercise is also important for bowel function, and movement can help stimulate your bowel. When I say exercise, this might include stretches, going for a gentle walk, might include doing housework, gardening, or a more formal exercise, but generally any movement is really good. If you're struggling to exercise or struggling to get into a routine, you could consider tummy massage. For example, if you're experiencing pain flares and haven't been perhaps for your usual walk or your normal exercise for a couple of days, you might notice your bowels slow down. In this instance, you might like to try some tummy massage and maybe some gentle stretches at home to help get things going again. Consider what you have in place if you know your activity levels are up and down. There's a link to tummy massage for constipation, which is on the resources page at the end of this presentation. We also know there is a two-way constant communication system between our brain, nervous system and the guts, and this is known as the brain-gut axis, and they can influence each other. So we know that stress, anxiety will influence bowel function, and so having measures in place to help manage stress can positively improve your bowel function. Next slide, please. The following tips can help with emptying your bowel well. So position when sat on the toilet is important, and we would recommend the use of a small footstool so that your knees are raised when you're sat on the loo. In this squat position, this helps to relax some of the muscles around the bowel, which can help straighten the rectum, leading to easier bowel emptying. Once in this position, ensure that your tummy is relaxed by letting it bulge forwards. Some people find taking a few deep breaths at the beginning also helpful for relaxing the tummy and pelvic floor muscles. Now, we do need some propulsion to help us move the poo, but straining is really not helpful, as this can cause us to tense up, and straining often can also contribute to hemorrhoids and can also weaken the pelvic floor. The brace and bulge technique, also known as the moo to poo, is a brilliant breathing technique that can help encourage all of this and may help with a more comfortable and complete bowel movement without straining. It's a breathing technique that uses your tummy to create some pressure to get things moving without excessive straining down into your bottom. Again, we've included the link to a video which describes this technique in more detail. This will be on the resources page at the end.
Great, so we're going to move on to bladders next. So what's normal? Well, a healthy bladder should be able to hold around about a pint of urine, and it's normal to visit the loo between 4 and 8 times during the day and possibly once at night. And all of this is influenced by various factors, including how much we drink. And how does it work? Well, think of the bladder like a balloon, which can stretch as it fills up gradually. The wall of the bladder is made of muscle, and there's sensors and nerve endings in that muscle that can sense stretch. So when they stretch, they know that the bladder is filling up. At the bottom of the bladder, the outlet to the pee tube, called the urethra, is normally kept closed, and the pelvic floor muscles help this. So as the bladder fills gradually and stretches, we start to get messages being sent to update us. And when the bladder is only a bit full, those messages will get sent, but we should be sending messages straight back, telling the bladder to keep relaxed and allow it to keep on filling up. As it gets more full, those messages get stronger, and they come to that level of our control system where we're then consciously aware of the need to have a wee. And at that point, that's when we can make a plan about when and where we're going to go to the loo. And in the meantime, the bladder should stay relaxed so that the urine stays put. We should be able to hold on, and we might need to consciously contract our pelvic floor muscles to help with this sometimes. So only when we've decided on that plan and then we've sat down on the loo and given the okay should the bladder empty. And for this to work, the muscles below need to relax, and then the bladder muscle itself contracts, and that's how we empty the bladder without the need to strain. When things go wrong, we can experience problems with holding on to urine. So that can include urgency, increased frequency to pee, going more often in the night, or leaking urine, which is called incontinence. Or there can be problems with emptying the bladder. So this could be slow flow or a stop-start flow, or a feeling that you're not emptying the bladder completely. Again, if you've got any of these following things, then we advise that you speak to your doctor or a member of your healthcare team before you kind of crack on with any of the self-help advice. If you have burning, stinging, pain or itching when you pee, if you can see blood in your wee, if there are new symptoms of needing to go often or urgently, if you've got tummy or back pain which is persisting and different to your usual symptoms, unexplained weight loss, unexplained fatigue, or a sense of being generally unwell. And again, also, if you've got bothersome symptoms related to your bladder and they're not responding to the simple self-help advice, do again speak to someone for some further support. So if you are experiencing any bladder symptoms, then it's useful to start with some simple measures, and generally these help keep bladders a little happier. The recommended amount to drink is between 1.5 litres and 2 litres a day, and aiming to avoid things that we know can irritate the bladder, so things like caffeine and tea and coffee, alcohol and fizzy drinks, as well as drinks which are either sugary or contain sweetness. Sipping your drinks through the day rather than downing a whole glass at once is often tolerated better by the bladder, especially if your bladder is sensitive. And if you're bothered by waking up at night to wee, then you can try avoiding much drinking kind of 2 hours before you go to bed. You're kind of aiming to wee about every 3 to 4 hours during the day. It's worth mentioning that if you're actually having problems with the emptying side of things, or that you're not always aware when your bladder's full, you might need to keep a little bit more of an eye on the clock and make sure you're not leaving it too long, because that can overstretch your bladder. It's really useful if you've got symptoms to complete a bladder diary, and this can give you a better look at your bladder habits, and we've got a link to one of those at the end as well. So these things can be useful if you are having difficulty or problems with emptying the bladder. So when you're on the loo, you must aim to sit comfortably and be as relaxed as possible. So you might try taking some slow deep breaths to help with that. Ensure you're able to take your time. Avoid hovering over the loo seat because your pelvic floor is unlikely to relax enough in this position. Do make sure you're not straining. If you don't feel you've emptied, then you can try moving around a bit. So you could rock forwards and back, or you can even kind of stand up, have a little wiggle, sit back down again, take another couple of deep breaths and see if you can pass a bit more urine that way. If you don't think you're emptying your bladder fully, you've tried the simple things and not getting anywhere, again, do bring that up to your doctor or one of your team. So if you struggle with urgency, so where the need to wee comes on really suddenly and it might feel tricky to hold on, or you're going to wee very frequently with or without leakage, these tips can be worth a try. So you want to aim to try and tune into what your bladder's telling you, but also don't wait too long. So don't wait till you're absolutely bursting because this can be hard to manage. You want to try and avoid those just in case wees. So they can become a really regular habit, particularly if you're concerned about being out and about and getting caught short. So we understand that's tricky, but gradually trying to see if you can cut any of those out can really help retrain your bladder. So these delaying tactics can be tried when you get that sudden urge to wee, and they can really make a difference in your ability to defer that urge and be able to hold on for a bit longer until it's convenient, or just to make a calmer walk to the loo if you do still want to go straight off. And bladder training is where we use these kind of techniques and over time gradually try and wait a little bit longer between trips to the loo. So it can be a really useful treatment for, as I said, urgency, frequency and leakage as well. What we do find is if you've also got a painful bladder, sort of as your bladder feels, then bladder training can feel really tricky and it can sometimes make you feel worse. So there is an alternative called bladder drill. It's slightly different. It involves timing, going to the loo at set time intervals. And this can be more helpful sort of to calm down a sensitive bladder. So you could also try this if you've tried bladder training and it really hasn't been good for you. So there are more resources on both of these techniques at the end. Over to Emily.
Okay, so next we're going to look at the external anatomy and also the pelvic floor muscle group. Next slide, please. So this is an image of the vulva, the external genitalia, and I'd like you all just to take a minute to see and have a little think about how many points on the vulva you might be able to label. So being aware of your own vulval anatomy and being able to name our own body parts is important, and regularly checking your own vulva can help you spot any changes, such as any new lumps or bumps or irritation. And learning the correct names like clitoris or labia can help normalise this body area, and it can make it a bit easier when discussing concerns with healthcare team. We know that experiencing pain in this body part can mean that we distance ourselves or disconnect from the body area. If you're able, beginning to look at your vulva and familiarise yourself with your own anatomy can be helpful when beginning to connect with this part of the body again. It's important to acknowledge that vulvas come in many shapes, sizes and colours, and that our media often portrays unrealistic body and beauty standards when it comes to this. Click please. So how many labels were you able to get? Next slide please. The pelvic floor muscles are a group of muscles that are like a sling or hammock at the bottom of the pelvis. They attach to the coccyx tailbone and to the pubic bone at the front and to our left and right seat bones. These muscles help to support the pelvic organs, the bladder, the uterus, also known as the womb, and the bowel. And the back passage, vaginal canal, and the urethra all pass through the muscles to exit the body. So why are these muscles important? Our pelvic floor helps us with our continence mechanisms to hold in wee, gas, or poo until we're ready to go. Often this is an automatic process, but we can also use these muscles to consciously delay going. And they also have a role in sexual function. And these muscles need to relax to allow for penetrative sex comfortably. But strong pelvic floor muscles are needed to help with sensation and orgasm. The pelvic floor also helps with labour and to support the pelvic organs, preventing or improving symptoms related to pelvic prolapse. It is important to remember that the pelvic floor, just like any other muscle, needs to be able to relax, soften and lengthen, as well as being able to contract strongly. Next slide, please. So some of you might feel like your pelvic floor muscles are in a permanently tightened position, or you may feel that you're struggling to relax or move the muscle at all. This could be the case if what you're experiencing is difficulty with peeing or pooing, or when inserting something into the vagina, such as the use of a tampon during a medical examination or during penetrative sex. Some of you may feel that your pelvic floor muscles are weak, or sometimes and often it's both. In clinic, we frequently hear my pelvic floor is tight. I shouldn't contract these muscles as I'm likely to make things worse. However, this is actually a myth. A pelvic floor appearing tense or tight on an examination can also be weak and uncoordinated. And often this is because of increased activity in the muscle, difficulty relaxing, and the muscle guarding in a protective way, and increased sensitivity of the nervous system. More often, this is a control issue, and we actually need to retrain both the contraction and the relaxation. Muscles really like movement, and we want a strong functioning and flexible pelvic floor. Now, there is evidence that moving your pelvic floor where you contract and relax the muscle can actually help improve your pain levels and muscle control. And there's also good evidence that suggests the pelvic floor relaxes better after contracting and strengthening it. And importantly, there's no evidence that an appropriate pelvic floor strengthening program increases muscle spasm or symptoms. We know pelvic floor rehab can be a useful part of a multimodal approach when it comes to management of pelvic pain and pelvic floor dysfunction. And often this needs a tailored approach to an individual, and a physiotherapy assessment can help establish a plan. The foundations of pelvic floor exercise often start with connection and being able to find your pelvic floor muscles. We may then progress to relaxing and contracting the muscle, and then on to strengthening. And I'll talk a bit more about all of these components in some more detail on the next few slides. Next slide, please. So first, you need to connect with your pelvic floor muscles and find the muscle. This can be tricky as they're internal and they're hidden. And also, if you've been in pain, you may have disconnected from this body area. To move the pelvic floor muscles, we teach that you gently squeeze around your back passage like you're stopping wind, and also gently squeeze around the vagina, and at the front, imagine that you're stopping a wee. There should be a sensation of a gentle squeeze and lift as you contract the muscle. You should then be able to feel the muscle relax and soften, feeling a sense of a let go as you relax again. By gently contracting the muscle first, this can help you feel and find them, making it easier to then feel a relaxation and understand how to let go and release the muscle. The flexibility of these muscles is important, and so we should try to focus on feeling the full range of movement. There are some things that we can do to help get some feedback on if we are correctly identifying and moving the correct muscles. The use of a small mirror can be really helpful. So by looking at your vulva as you practice the contract and relax, you should be able to see a slight indrawing of the perineal skin as the muscles contract, and then a small movement back down as the muscles relax again. For others, or if you prefer, you can insert a finger into the vaginal canal, and you should be able to feel a slight tension around your finger as you contract the muscle. And then also feel the muscles relax and soften around your finger as you relax again. Finally, sitting on a firm chair or over a rolled towel or over a bolster will provide a slight pressure to the perineum, which can help improve sensation and feedback. If starting here with the pelvic floor feels quite daunting, then for some, actually starting with gentle meditation or breathing practice or pelvic floor relaxation might be a good starting point when beginning to connect with the pelvic floor muscles. Next slide, please. Thank you. So because of where the muscles are, it is difficult to know how to relax or even begin to stretch the muscle. For example, if you had a tight calf muscle, I'm sure that most of you would be able to have a go instinctively at stretching it, but often this isn't the case when it comes to the pelvic floor. If you're struggling to contract and lift and let go or release the pelvic floor muscles, or if you are experiencing symptoms such as difficulty with emptying the bladder or bowel, or pain with penetrative sex examinations or tampons, then pelvic floor relaxation techniques might be quite helpful to try. And this includes the use of breath work, such as diaphragmatic breathing, and this can be a useful tool, and I'll go on to explain this in a bit more detail. Gentle movements or yoga-based stretches that help open the pelvis can be great, and you can incorporate diaphragmatic breathing when performing these stretches. The pictures on the slide are showing some good examples. So we've got the reclined butterfly, which is a position laying on your back and gently relaxing your knees to the side, or child's pose, and you can widen the knee position as well. Global relaxation techniques like mindfulness or progressive muscle relaxation techniques such as the lower mitral exercise can also be really helpful. And finally, as I've mentioned, actually contracting and then relaxing the muscle is also shown to support pelvic floor relaxation. Next slide, please. Thank you. So, diaphragmatic breathing or belly breathing is a deep breathing exercise that uses the diaphragm muscle, which is a dome-shaped muscle under the lung, to help fully engage the lungs, making breathing slower, deeper, and promoting relaxation by activating the body's calm response instead of shallow chest breathing. Feel free to join in as I'll describe how to perform it. So this can be done laying on your back with your knees bent, or if you're sitting comfortably in a chair. Place one hand on your upper chest and the other hand on your lower belly, just below your rib cage. Inhale, slowly breathe in through your nose, feeling your belly push into your hands outwards. Imagine blowing a balloon up in your lower tummy. Your chest hand should move very little. Then exhale gently, feeling your belly contract inwards as the air leaves, and again keeping your chest hand really still. Concentrate on the movement in the tummy, not in the top of the chest, and this will help ensure that you're using the diaphragm effectively. You might like to try up to 3 to 5 deeper volume breaths and then return to smaller volume breaths, and this is to help prevent feeling a bit lightheaded. If we are experiencing pain or if we anticipate pain, the pelvic floor muscles can contract or become tense, and often this is a protective mechanism. We might also notice tense tummy and shallow breathing. We know that there is really good evidence that diaphragmatic breathing can help with regulating the nervous system and dialing down those pain responses. It's also really helpful stress and anxiety, really helpful for stress and anxiety. Plus, it's quite common to hold your breath when doing pelvic floor exercise, and so working on some breathing techniques such as this can help to overcome that. In clinic, we find that diaphragmatic breathing is a helpful tool when starting working with the pelvic floor, but we don't have evidence that the breathing itself or on its own links with fixing pelvic floor problems. Next slide, please. So, moving on to strengthening of the pelvic floor, there is high quality and robust evidence that pelvic floor strengthening is recommended, especially with symptoms related to bladder and bowel incontinence. And this is included in the NICE guidance, which provides recommendations based on the best available scientific evidence. And plus, we know that a stronger pelvic floor is better able to fully relax after load. If you can feel and identify the pelvic floor muscles and you're able to feel the muscles contract and relax, you could progress to a strengthening program. Strengthening program should include short squeezes where you contract and relax the muscle quickly, and long squeezes where you squeeze the muscle and hold for a few seconds and then let go. A program of 10 short squeezes and 10 long squeezes of up to 10 seconds is often recommended as a good starting point. This can be completed up to 3 times per day. With the long holds, you need to be and feel in control of the let go and the relaxation. And so for some people, they may only be able to manage a shorter hold duration, such as 2 or 3 seconds, and then would gradually build up towards a 10-second hold. Physiotherapists would be able to advise on a strengthening program that's tailored to you. And apps such as the Squeezy app are popular and can help with remembering these exercises, and they can send reminders and a prompt to your phone. If, when increasing these exercises, this causes some discomfort, the following tips might help. So rather than a full squeeze, you can try a more gentle squeeze, and for some, aiming for a 90% effort can be a helpful prompt. Don't rush your exercises, so adding a longer rest break between your squeezes can also be really helpful. Or adding in some breathing techniques, such as the diaphragmatic breathing between your repetitions can help. Or incorporating other general relaxation before or after the exercise. This might be a warm bath, it might be a mindfulness practice, or maybe yoga stretches. And also think about what position you're in when you perform these exercises. So starting laying down or sitting is often best to help focus on the movement initially, but then progressing to standing positions can be really good to help support strengthening. And finally, you shouldn't stop mid-wee. So if you're going for a wee, don't attempt to squeeze your pelvic floor as you pass the urine. The advice we've covered just now is designed as a starting point for self-help for working with your pelvic floor. It's not designed to replace any more tailored advice that you might have received from a healthcare professional or physiotherapist that you've seen. If you're trying the self-help advice and it is making things worse, or things aren't improving, or perhaps you're still struggling to find your pelvic floor, then it might be helpful to investigate to see if you can see a pelvic health physio for some further self-help advice and guidance. Passing back to Becca now.
Great, so moving on, we're going to just dive into a bit of movement and exercise in the next couple of slides. So if you have pelvic pain, you may find that your relationship with movement and exercise has shifted. You might find you've gradually reduced what you do and that you don't really know what you should be doing or maybe where to start again. Common barriers are the pain itself and flare-ups of pain, limiting ability to do normal routines, a sense of yo-yoing between being active and then not active at all. Difficult cycles with heavy or long periods can obviously be a challenge. Fatigue is a common symptom in endometriosis, and this can mean maybe prioritizing other commitments over your exercise in terms of energy levels, and other health conditions can also add to this burden. You might over time become or have become fearful of movement and wondering, if I do this, how will I feel later, or how will I feel tomorrow? Mood and mental health challenges can also make it hard and affect motivation, and there's of course the usual practicalities of life, having enough time and working around other commitments. We often hear a bit of an all or nothing approach. For example, I used to do a 10K run and now I can't, so I'm not really doing anything because I don't really like anything else. Sometimes the challenges just feel so big, it's easier not to carry on with things. Or other times we work with individuals that are kind of pressing on and on with their exercise, even though there's a sense maybe it's not feeling like the most helpful thing in terms of managing their pain. So despite all those challenges, it is important because it has so many benefits. There are the obvious general health ones for our heart, for our bone health, and much more. There's the positive impact on mood and on sleep, both of which are very important for the management of pain. Gentle movements can help dial down the nervous system and improve pain too. And in the context of endometriosis specifically, exercise might help with stabilizing hormones and improving blood flow to help inflammation. In essence, it can be part of that overall plan of working on pain and improving your quality of life. And we have good, well-established science for the role of movement and exercise in the sort of general persistent pain population. We have some newer science of positive impacts of exercise, specifically with persistent pelvic pain, painful periods, and more specifically, endometriosis as well. So in order to utilise movement as a helpful tool, it can involve us kind of reframing beliefs around it. So it might be that we need to go a lot more gently, start small and build up. Sometimes reframing that word and coming away from exercise or fitness and actually using movement or activity can feel more achievable. If we start small, our nervous system can get used to the new activity and allow us to gradually build things up. Consider how often, how intense, how long the activity is, and what your rest, give yourself rest days too. Don't forget about pacing, and that's covered in one of the other webinars. And it's helpful to think about what you enjoy and what makes it social, because that can help you do it. Overall, it's about building your confidence so that you can judge what feels right on a given day, so that you learn how to adapt and you feel you can continue rather than this all or nothing approach. We'd really recommend you building some restorative movement into your routines, and this is gentle movement or stretches that helps to dial down the nervous system, ease tension and spasm in the muscles. It should feel good, help you connect with your bodies again. Think of it as your foundation of exercises. It's the things that you try to do on your not so good days as well as your good days, where on a pain flare day you might cancel an energetic gym class understandably, but hopefully at home you still feel you can do your gentle movements. It's about having a go and finding your favourites, finding your go-tos. Examples might be some gentle pelvic stretches, got some examples in the resources later, like the qigong, gentle yoga, or even just circling the hips or rolling the shoulders. And we understand trying to put all this into practice during a flare can feel really tricky, but it can be another useful tool in the flare-up kit too. What happens during a flare? Well, we might get more muscle tension or spasm. We might feel stiffer or tighter in muscles and joints. We might be in more sort of flexed curl postures more often, reducing activity, spending more time in bed or curled up. Over time feeling weaker and deconditioned. And all of that has an impact on the nervous system. It turns up the sensitivity, it increases that fear level, more likely to avoid things. The system tends to in turn turn up the pain. So some ideas of how you can work on this in a flare is just take time, notice what can you feel. You're holding your breath, are you tense in a certain area? Can you incorporate those gentle movements, your favourite ones, adapting where needed? If you try them on a good day, you're more likely to feel confident on a tricky day. You might move more slowly or more gently. Movement snacking is this idea of little nuggets of movement built into your day, like maybe sort of 5 shoulder rolls, or just that intention to have a stand up and stretch your arms towards the ceiling. Maybe even just taking 3 of those deep tummy breaths if that's all you can manage. And positive mantras as well, not forgetting that how we sort of think and feel about our pain can have an impact here too. So we said it was a whistle-stop tour. To finish up, one of the reasons we wanted to do this is we know it can feel a bit tricky sometimes to know how to see a physio yourselves in your local areas. Services do differ across the country, waiting lists can be long, criteria can be different, and there aren't enough of us to go around, if the truth be told. For many, we hope some of this advice does give you a starting point along with the resources and the webinar series as a whole, of course, but we understand it won't be enough for everyone. And if you're struggling, you might find you do want to investigate seeing a physio. Best place to start is with your GP or your endo or gynae team, and they'll know what's available in your area. If you do want to have a look privately, then the POGP Find a Physio is good. You can see a QR code there. And all the resources we've mentioned are linked in this one here. Hopefully you can take a screenshot, come back to that, and it will be in the recording, of course, for you to come back to. Thank you so much for listening, and we've got a bit of time for some questions.
Okay, thank you so much. I'm going to jump to some of the pre-submitted questions we have on my screen over here. So we had a lot of questions, both live actually and pre-submitted, about specific exercises people could do. I know you've already discussed some of them in your webinar, but what would you advise viewers to maybe try at home who may not have access to a physio?
Shall I start, Emily?
Yeah, go for it.
Yeah, so it's absolutely, it's always ideal to make it individual and tailored to that person, but absolutely there are some starting points that can be good ideas. And in the resources, we've got a number of different kind of exercises and stretches that we recommend really frequently and use with different women in clinic. So those are a really good place to start. And we'd recommend kind of having a little look, choosing a couple that you feel look manageable and just having a try. You might not crack it first time. So it is trial and error and just gently having a go. I would say like quite a lot of the time we'll find, maybe women aren't comfortable on their back. So we'll look at an exercise in a different position or, it is individual and there are some different options in the resources. I think one of our real go-tos that we use a lot would be like a child's pose, which is a yoga type position. There was a picture up on one of the slides earlier when we were talking about like pelvic floor relaxation. So on your knees, wider knees and then coming forward and leaning down into a stretch. That tends to work really well. Again, it's not going to be for everyone, but we do find quite a lot of the time that's a nice one. You can do some nice that deep breathing in that position, and you can sort of work on your pelvic floor relaxation in that position as well. Helps you kind of tune into that general area, which can be really useful. And you can modify it by how wide your knees are, how low down you lean forward, and things like that as well. And I'd say like the other kind of key exercise that we use time and time again is just encouraging that diaphragmatic breathing that Emily taught as well. So that would probably be our other kind of real go-to. But yeah, just having a bit of being brave to try some of the other ones as well.
Brilliant, thank you. We've had another question pre-submitted there asking, do we need to take care of the pelvic floor post-surgery?
Want to go, Emily?
Yeah, shall I go ahead? So I think following any surgery, first off, you should take some guidance from your surgical team, so relating to your individual recovery. But yes, generally following surgery, we would, assuming that there's no complications or issue with recovery, and that you're weeing and pooing okay, then yes, absolutely, pelvic floor exercises can be restarted. And as we mentioned, that's not just those strengthening Kegel exercise. It might be ensuring that you're moving the muscle through full range of movement, and then perhaps progressing to some strengthening exercise program with those short squeezes and those longer squeezes. Important post-surgery to also be ensure that we're managing bowels well. Often constipation can be a problem in those early days post-operatively, especially if there's maybe pain relief medication on board as well. A common side effect of codeine-based pain relief is constipation, and so looking after bladder and bowel function will also positively affect your pelvic floor. But generally, as normally once any catheters removed, you're able to pee and poo, then yes, restarting gentle pelvic floor exercise is advised. And again, here we can consider position. So lay down, we generally can be a little bit easier for some people. So you might start in maybe lying on your back or side lying position, progressing to sitting and then on to standing. But I certainly would also seek, as I mentioned, some guidance from your surgical team just relating to your individual circumstance.
Brilliant, thank you so much, Emily. We've got a question there from somebody. They asked, how can we rehabilitate the pelvis and abdominal muscles after a cesarean?
Do you want to, oh, no.
Do you want to go, Emily, or do you want me to?
I don't mind.
Go for it.
Sure. So this is a really good question. And generally, after delivery, pelvic floor exercises can be started straight away. And so again, as long as there's no catheter in place, so that could be just a little bit uncomfy when contracting the pelvic floor. But otherwise, you can restart pelvic floor exercises. So again, starting with first identifying the movement in the pelvic floor muscle, and then adding in a more strengthening program, such as those short and long squeezes, as we've talked about. Tummy muscles following abdominal surgery, including C-section. So for the first 6 weeks following an open abdominal surgery, such as with a C-section, often caution is advised to avoid anything very strenuous, and that's to help with soft tissue healing. But usually a graded return to activity and then back up to exercise is advised. So again, this might be first off starting with something as simple as the tummy breathing exercise, or maybe gentle walking in those early few days and early weeks, and then gradually progressing back to your normal activity, and then gradually progressing on to exercise. The POGP or POGP webpage that we mentioned has some really useful booklets and suggestions for some gentle abdominal exercise that can be started postnatally and following, including following a C-section. So I would definitely recommend taking a look there. And then usually from the 6 to 12 week mark, it's a gradual increase in activity. But you could also speak to your healthcare team, again, for some more tailored advice relating to you individually.
Brilliant. Thank you, Emily. I'm going to jump to one of our live questions there, and someone's asked, after a hysterectomy, can you or should you do pelvic floor strengthening exercises?
Yeah, another great question. Yeah, absolutely. So again, as with all of these questions, it's going to be individual circumstances, but potentially that could be, yes, absolutely a sort of important part of the recovery. So as Emily's kind of touched on previous there, like it might be that you first need to kind of do your breathing, connect again with the pelvic floor, maybe do a little bit of the relaxation to feel comfortable and confident. But absolutely, it would be potentially really beneficial to then gradually build in some of that strengthening as well. So you want that strong, healthy, yet flexible pelvic floor, just like we were talking about earlier, regardless of the situation. If you had a hysterectomy, it's a big surgery, and you really do want that nice support product underneath to be working well. Obviously, if you've got any kind of specific symptoms, so bladder or bowel or other things there, that you might be sort of raising your concern about what's happening with the pelvic floor function, then you might want a bit more tailored support. So, you might want to see if you can seek out a pelvic health physio. But certainly, yeah, starting with a gentle approach and working through some of those things we've gone through is a good starting place. And the same, as we've said, post-surgery, bladder care, bowel care, avoiding constipation, good position on the loo, all of that stuff as well.
Brilliant, thank you. We've had a live and pre-submitted question the same there, so I'll ask this one. Someone's asked, does Pilates help, or is it a good way to help your pelvic floor, or are there more things, more endometriosis specific, that people can do?
Yeah, should I take that? So yeah, Pilates is great. It's one of many different types of exercise, and for some people it will feel like a really good option. It's quite a sort of low impact exercise, involves the whole body, which is great. And yeah, for many it can be a good way to stay active and provide a bit of strength and stuff as well. So absolutely can be part of your kind of overall approach to managing endometriosis and pain and symptoms. You might want to consider kind of complementing it with some of the things we touched on this evening. So, for example, if you're wanting to make sure you're targeting like the pelvic floor, then you might want to complement it with some of those techniques, be it the sort of relaxation, or even adding in some strengthening if that's a concern as well. Because there's sometimes a misconception that people think doing Pilates is doing their pelvic floor exercises, and it sometimes you do a little bit of it in a class, and that's great, but and it's good in its own right, but it doesn't kind of necessarily replace those more specific things you might be working on with your pelvic floor. But yeah, absolutely, can be a really nice option for some.
Brilliant, thank you. Somebody has asked, do you have to be a certain age to access physiotherapy, or a certain stage or grading of endometriosis?
Often in the NHS services, pelvic health is usually an adult service. That's certainly the case here at North Bristol NHS Trust, and we generally accept referrals from ages 16 to 17 upwards. I obviously can't speak for all NHS services across the UK, but that's generally the case. So in terms of certain age for adult pelvic health physio, yeah, sort of late teenage years and upwards, and there's obviously no upper limit to that. I think it was touched upon in the presentation, but we know that severity of symptoms doesn't directly correlate with stages of endometriosis. So this isn't a criteria when accessing physiotherapy. This is more sort of symptom driven, and how those symptoms might be impacting you as an individual, and impacting your quality of life. And severity of those symptoms. So stage of endometriosis is not a criteria.
Brilliant, thank you so much. I've got a question here from somebody who's asked, can the physios please give me advice on how to deal with nervousness about going for pelvic floor physiotherapy, as I'm very nervous?
I think this is a really good question, and I'm sure that's going to be many people perhaps in the audience that also feel the same or have had similar feelings. The webinar that's on your website, so that previous webinar from a physiotherapist covers what to expect when attending a physiotherapy appointment. So I think that could be really helpful to review, and to help just give you a bit of an overview about what you might expect. Of course, if you have a very specific worry or concern, you might be able to contact the department that you're attending ahead of your appointments, and just to get some clarification if it's quite a specific worry. Some people choose to visit the hospitals ahead of their appointment, so maybe just to figure out, how do I get there, what's the parking like, where am I actually going, where do I wait, just to help demystify and just maybe feel a little bit more relaxed on the day. Other things that could help would be perhaps bringing a friend or family member, so like a more informal chaperone, or you could ask for a more formal chaperone ahead of attending. If that helps. Usually in a first appointment or an initial assessment, tends to be a lot of talking. So normally the physiotherapist will want to go into the history, the symptoms, and somebody's main concern. And there would never be any pressure to have an internal examination. Often this is discussed, but they should go into detail about why it's being advised, why we're suggesting it, what it will involve. And then you may be able to talk to your therapist about if there's any specific concerns related to that, if there's any modifications that we can make, or it might be something that's revisited at future appointments, or not at all. And as I said, it's not compulsory. So some people do say, actually, you know what, internal examination is not for me at the moment, and so therefore it's not. We don't go ahead. During our appointments, we'll try to listen. So try to listen to sort of your history, your story, and do our best to explain what options we might have at our disposal, so that we can make a plan and try to help manage the symptoms. And I can't think of anything else that's on my head. I don't know, Becca, if you have anything else to add there, but I think it's a really good question. Thank you.
Yeah, no, I think you've covered it.
Brilliant, thank you so much. And I think we've got time for one last question before we wrap up quickly. Is there a one size fits all physiotherapy when it comes to endometriosis, or is it based on individual circumstances?
Yeah, great question, and hopefully we've started to answer that a little bit as we've been going through things this evening, and you're getting the gist that it is very individual, because everyone will present with a different kind of set of bothersome symptoms, and as Emily said, particularly when you come to see us in physio, we're interested in what's bothersome for you, what's important to you. And that then guides, obviously, the physio and the treatment. So appreciate that as a webinar. It feels a bit more general because we're trying to reach lots of people, but we hope that you can try to pick things that feel relevant to you as a starting point. And obviously, if you do have access to physio, fantastic. And we hope that does offer more of an individual tailored approach for you, and that's useful. But I think we're just realistic about the situation, and so we hope that having some free tools kind of accessible at least gives you a starting point. But yeah, very much individual. It's based on what things are like for you, and what you want to work on, what you're open to. Some things you just won't like the sound of, and that's okay. That is all right. So across the whole series, I think it's going to be 5 in total. Hopefully, there will be bits that stand out to you more. It might be more the physio stuff. It might be not. It might be some of the other bits that are covered. So yeah, I hope that there's something for everyone across the series.
Brilliant. Thank you so much. That is all the time we have for tonight. So I'd like to say a massive thank you to both Emily and Rebecca for today's webinar, and thank you for everybody who joined us today and submitted their questions. If your question went unanswered, or if you have any additional questions, please do email them to support@endometriosis-uk.org, or you can visit our website and book a call with one of our nurse advisors. There will be a survey at the end of this webinar, so we kindly ask if you have any time to please complete it. Rebecca and Emily, do you have any sort of final notes for the audience watching tonight?
I guess not loads to add. I think, as you said, it was a whistle-stop tour. We've tried to cover quite a bit in a short space of time. Do dip into those resources, whether you took a screenshot or you can pop back when the webinar's up and published on the website. And try and have the confidence to give a few things a try. It's a small thing, it's little changes. It can feel overwhelming, but just start with one small thing.
Yeah, I can only echo what Becca said. I think we have covered an awful lot, and that can feel quite overwhelming. So, as Becca said, starting with some bits that maybe speak to you a little bit more, or that you identify with initially, do try out those resources as well. And thank you for listening.
Yeah, thank you.